Sorry. My name is Dr. Taiwo Morakinyo, a personal physician with the Limi Hospital Group, and this is
Alice Ekejuba, clinical psychologist.
this is, as we said before, this is another edition of the Limi Hospital Instagram Live, and we are talking about anxiety disorders. So we picked up from the connection between spirituality and anxiety disorders.
Okay, this is Nigeria. Everything is spiritual. Even when you have headache, there's a chance that maybe somebody from the village is affected, is pursuing you. But and sorry to say, I'm a Christian, but our spiritual leaders are not helping us so much, even though they are trying to like alleviate whatever it is that we're dealing with,
Some
but
of
they
this.
are taking it from their own perspective of how they understand it. No, there is no connection between anxiety disorder and spiritual problem. They are two different things. If you're dealing with an issue, go to a professional so that they can do proper investigation and find out what is wrong with you. That's why, like I said, the Freudian approach that like maybe there's an unresolved conflict somewhere that you're dealing with. It could be anything. It could be childhood issue. It could be some kind of relationship that you didn't deal with properly and you're still struggling with it. It can be anything, or probably some sort of fear that you nurtured over time, but you repressed it and now it's coming out. So no, it's not a spiritual problem. Just go to a professional, get a proper diagnosis, then they can help you out with whatever you're going through.
So, is there any lifestyle modifications that can be made to, prevent anxiety disorders?
Absolutely. Absolutely. Depending on what the person is presenting. Like, let's just say, for instance, the common one that we say every day, oh, my work is stressing me. My work is so stressful.
That's the most common.
That's the most
We've all been through
common
it. Work
one.
stress just
So
affecting
what do
your life. You
you
go
do?
home,
What do you
and yeah.
do? Is the work stress associated with probably with your relationship with your co-workers? Has it to do with your relationship with your boss? Has it to do with your workload? Has it to do with probably the equipment you're working with? Are you like skilled enough to use that equipment? Because a bad workman always quarrels with his tools. Yes. Do you have the capacity to work where you're working? Okay, let's just say it has to do with your workload. So why don't you plan yourself? You already know what you're meant to do. So you can actually plan yourself and say, okay, I can do this from this. And so you can apportion time to various tasks so that you can get it covered. Nobody knows it or nobody can do it all, but you can actually manage yourself so you don't get overwhelmed. Like there's some offices that you have like 1,000 of work. Why don't you prioritize? Which one comes first and which one goes. I don't know if you're getting what I'm saying. So that could help you deal with your work stress. The one that I always suggest to people, in a day, make your to-do list according to your priority. If you have a message that your MD sent you, just do that. Put that one on number one. And probably there's an interruption coming from your middle manager. Oh, what of this? That okay, just give me so and so time. Okay, I can pause this one because I have like time to like a space where I can let me do this one, then go back to. But you have to list out what you need to do so you don't get carried away from point A to point D with by jumping B, C, and the rest of them. So you need to plan yourself. Lifestyle can actually cause anxiety for you. If you're somebody that is in your house, you're always disorganized. Anytime, okay, let's go for something. You're looking for one shoe here, you're looking for one clothes there. You before you step out of that, you're already stressed out. You're already stressed out. So you can actually plan your life in such a way that you don't get affected or you don't get overwhelmed with what is happening around you. Yes, you can actually modify your lifestyle to help you deal with anxiety.
Okay, that is very, very informative. So you can make lifestyle like modifications to help you deal with stress, to help you deal with anxiety, and you will be fine. Can you deal with anxiety and stress with alcohol,
Well,
drugs?
that's a tricky one because it's like this. Most people that indulge in this substance use, alcohol use, when I drink, it makes me feel
Feel, all
okay
my
and all the
problems
rest
go
of them.
away.
Alcohol is a depressant. But the thing is, when you drink it, it acts as a stimulant. Like you feel high, you feel
You feel
elated,
good.
then you feel good. But aftermath is that it crashes you. You go back to ground zero, where it's like you feel all messed up. So yes, people that have substance use disorder, are prone to taking alcohol, are more likely to have anxiety disorder. There's a strong correlation between those two.
Yeah, that makes sense. So if you are dealing with stress, using drugs or drinking alcohol is not the
It
right
won't
way to go
help you.
because
It
your
won't
problem
help
will
you.
go away for just a few moments and then they will come back.
More amplified, more with
So
even more
it's been a
symptoms.
really nice discussion um, since. We would like to have some questions from the audience. This is supposed to be a two-way street. If there's anything they would like to ask us so that we can address. Okay, so what is post-traumatic stress disorder?
Post-traumatic stress disorder is a form of anxiety. It's usually associated when somebody have a traumatic life event, like a life-changing event. Like I said, wars can cause post-traumatic stress disorder. Somebody that your house got burned down, or somebody that was sexually assaulted, or somebody that was beaten, or somebody that was involved in an accident
Or
or
like we said
something.
before, people that have gone to fight
Yes,
wars.
yeah,
Yeah.
it's post-traumatic stress disorder. The thing about post-traumatic stress disorder is that it doesn't show. People that experience those things, those traumatic life events, it doesn't show immediately. Maybe after a while, they start having flashback and all the rest of them. Then the symptoms start manifesting.
Is this something that is common
It's
in
not
our
really.
immediate
It's not.
environment?
No. It's not really common. Post-traumatic disorder doesn't just fall on you like anxiety and all the rest of them does, but there must be something very troubling, something very hot for something that is really, really, really intense to give you post-traumatic experience that you don't want to deal with, or experience that is really life-threatening before you can say, okay, it's post-traumatic stress disorder.
Okay, so we have a question from our audience. It says, how do you know you're having anxiety disorder?
Like I said, you don't give yourself diagnosis. Oh, I can't sleep. I'm having anxiety
I
disorder.
know, but
No,
how do you know that?
you need to go to a hospital, get proper diagnosis. You don't just diagnose yourself. But like I said, according to DSM-5, you have to have the symptoms for over at least 6 months.
Can we run through those symptoms again so that our audience
The
can?
symptoms include trembling, sweaty palms, gastrointestinal disorder, nightmares, tense muscle, heart palpitation, tightening of breath, muscle pains,
Muscle pains,
sleepless nights, um, too much worry, like your
irrational
irrational
fear
fears and all the
and
rest of
worry
them.
about the future, trouble
Exactly.
sleeping, sometimes palpitations, breathlessness,
Yes. So
panic,
when you find out that you've been having these
symptoms
symptoms
for
and
some
probably you've
time.
gone to check yourself and they say, oh, there's nothing wrong with
Wrong with
you.
you, your body is fine, but still you
You
can't
still,
sleep, you
exactly,
have
you need
palpitations, you're
to,
always sweating, you're always panicking.
you need to go see, get a proper diagnosis. That's how you deal with it.
Another question, does anxiety cause insomnia or exhaustion even after sleeping?
Yes.
Okay, so this question is insomnia means not being able to sleep. So, but anxiety causes insomnia, yes. Anxiety can lead to lack
Sleepless nights.
sleepless nights. You find it hard to sleep because you're always worrying, you're always scared.
And even when you sleep, you wake
You
up
have
tired
yes, you can even have terrible dreams.
and
Yes,
nightmares.
so anxiety causes exhaustion even after sleeping. Yes, causes you wake up early, you wake up in the morning and you are tired. Early in the morning, you've slept for 6, 8 hours and you're
You're
tired.
still tired.
Yes, anxiety does that. And if you've had those symptoms for some time, you should seek help. You should don't go and drink alcohol or smoke something
Or give
or
yourself
eat
self
something
medicate
or go
yourself to.
and fast for 30 days. Come and seek help. See a doctor, see a clinical psychologist, and get the help that you deserve. So, do we have any more questions? Let's see. What are the risk factors for anxiety disorders?
Risk factors. Let's just say you mentioned having a patient who was driving.
Who was driving?
So you can imagine that happening to you on a highway. and you have to like lose control of your car that you.
So it can be a serious
Yeah, it
problem.
can be a serious
And
problem.
some of the things that can, predispose people to anxiety
Anxiety.
disorders, like um, my like the clinical psychologist has said, family history of anxiety disorders, the genetic
The
factor,
genetic
the
factor.
hereditary factor, history of a major traumatic
Sick
event,
events
an
and
early childhood event, you know, like the example that I gave, that the patient has been rejected twice from the
exactly.
embassy, and now she has another one coming, and she can't sleep. Those are the risk factors from of anxiety disorder. Genetic genetic factor, that is history of anxiety disorder in the family, um traumatic traumatic event, early childhood events. Okay, how can I stop anxiety disorder from affecting my job?
Like I mentioned, when it has to do with your job, you have to plan yourself well. Let's just say you're living in a far place and getting to your workplace can be a bit of problem maybe by the time.
Yes, you're in traffic for two
Exactly.
hours
So why don't you try going to bed on time so you can wake up on time? Why don't you try overnight before you get to work? Plan what you're going to wear. It saves you time. So by that way, you've already get your morning secured. You're already off the job. You get to the office first, then you relax. Then plan your day. What is on your desk for you to do? Prioritize them. Which one comes first? Which one needs your attention? I know sometimes you've done your to-do list, but other responsibilities comes in. Know how you're going to plan yourself so that those responsibilities don't clash. Remember, you're one person, and since you're one person and you need to be in a good mental state for you to give your best. So prioritize your health first, plan yourself, do what you can do, but don't say, oh, I'm prioritizing myself, you're there sleeping on the decks. That's not prioritizing yourself. Plan yourself in such a way that your job, if it's something you need to delegate to somebody else, delegate it to somebody else. If it's something you need help from, ask somebody to help you. Don't be jack of all trades who can do all things. That way you relieve stress. And if there's anything that you don't understand, get clarity. Ask your manager or whoever that gives you that responsibility the questions pertaining what they give you so that you don't go confuse yourself, making you do the job 2 times. So yes.
Okay, there's another question. Can anxiety cause other illnesses?
Yes. 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 What is heart palpitation?
Yeah.
What is shortness of
High,
breath?
high,
What is
high blood
gastrointestinal
problem,
disturbance?
disturbances,
What is high blood
pressure.
pressure?
Yes, yes. So
What is
anxiety,
insomnia?
yes,
Sleepless
nights.
nights?
If you are not sleeping, you
Yes,
might
it's a problem. It's an illness on its
headaches.
own.
You
There's
know.
headaches, exactly. There's tiredness. It's an illness on its own.
So anxiety disorder is not something that you can just, if you are experiencing symptoms of anxiety, chronic anxiety, it's not something that you can just brush aside and say, oh, I'm going to deal with it. You need to seek help, because if you don't, it will compound and it will now lead to, tangible physical problems for you. So do you have any other questions? Okay, why does anxiety cause panic attacks?
I think it has to do with the brain function. Because when you're stressed, there are two hormones that are released in your brain, the adrenaline and the cortisol. And what are those hormones for? For flight and
Flight,
fight.
yes.
So, but when you're under stress or anxious, those hormones get released because they are there to do their function.
So the panic attacks is just like
Yeah,
your brain's
response,
normal flight of fight or flight
flight,
response to
exactly,
to
because that
escape
chemical is
stress.
already in your system.
Yeah.
So that is why you get panic attacks because your mind, your system is giving you the information something is wrong somewhere, and your heart is responding to the signal is getting.
Okay. So what do you do when you see someone having a panic attack? Because in our society,
What do
someone
you
might just be
do,
having a panic attack in the
what can the person do?
what maybe you or the person. Someone can just be having a panic
There are two
attack.
different things.
Yeah, they are two. We will address both.
Yeah.
Someone can be having maybe you're in the market, someone is having a panic attack, and then you see people thinking maybe it's something else.
No, 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 no. First and foremost, get the person to relax in a relaxing posture. right?
Okay.
Depending on what the person is present, if there's shortness of breath, make sure the person have a lot of space to
Space.
breathe.
Breathe.
First of make sure the person is
So
relaxed.
make sure the person is safe, clear the
Yeah, clear the
area.
areas and let there be free flow of air so that they can get enough air. And the next thing, probably if the person is responsive to you, ask questions, what is wrong with you, so you can know what next to do. Because you don't just assume it's a panic attack before you know it's a panic attack. Maybe the person, do you have this kind of condition before your heart might just relax. Try to calm the person down. Because the person that is going through it is already anxious, like their anxiety level is peaked.
Great.
So you try to get the person to relax. But if you are the person, you already know what is wrong with you. Also, you have to get yourself in a comfortable position. Sit down, breathing, like we call it breathing technique.
Okay.
You
Exercises.
yes, because part of the symptoms is shortness of breath. You find it difficult to breathe. So now you have to be conscious about your breathing. You draw in air, you let it out, draw in air, so you can get control of yourself. Next, when you start doing that exercise, you find out that your heart rate start decreasing. Started decreasing. There's also what we call mindfulness technique. You can use any of the mindfulness technique that works for you, but that is if you know what mindfulness technique is.
Well,
So
to
that's
know
why you
what
need a
mindfulness
special
techniques is, you need to see a clinical
psychologist.
psychologist.
So yes.
There's not enough time. Okay. What can be the cause? I always start sweating when I enter the lift. Okay, you might be claustrophobic. I think
Yeah, it's the same sort of phobia.
it's a
So
type of anxiety.
it's a type of
Anxiety.
anxiety
Maybe you have an irrational fear
of
of closed,
small
small
space.
spaces, closed spaces.
And
Yes.
probably you have stories of people who get stuck in elevators. So it's
Yeah.
always stuck in your
Or maybe
subconscious mind.
okay, maybe you've
Or
had
watch movie that you saw
or you
somebody.
maybe you've had
It
like
could
an
be
earlier
anything.
like event that might have. Okay, so what is stress?
And this is the third time I'm answering that question.
Okay, we need to stress
Stress
we need
is
to stress on stress because
stress is a response to life-threatening situations or instance or conditions that makes you uncomfortable.
so
Yes,
like a
is a
psychological
response. Is
response
a
to
response to
pressure.
pressure and stuff like that.
Okay,
Yes.
so what are the 5 most common types of anxiety disorders? We've said that before.
You
Maybe
said that.
you
Let me
can run
just
through
yes,
them
the general
again,
anxiety disorder,
which
which
is
is
that's the most common.
that one you can't even pinpoint why you're having anxiety
Anxiety disorder,
disorder.
and you just
You
have it.
can you just have it. The symptoms are there. You're dealing with it. Then there is the phobic anxiety.
That's the phobia,
Yeah, the
fear
people
of
that
this,
exact
irrational fear of that.
exact. Then there's social anxiety. That one you see it like almost it's common because you see someone, okay, you need to do it. No, I can't do it. Oh, I will not talk in public.
And it
Oh,
is different from shyness. Like me now,
exactly,
I'm
lack of
shy, but
yeah.
social anxiety is something that
Yes,
is
I saw
pathological.
a client that his job entails him doing presentation
Mm.
most of the time, and he has chronic fear for presentation. So every time he's about to he starts sweating, he starts gasping for air.
Having
So
palpitations,
exactly, so
wow,
that could be also a form of social
anxiety,
anxiety, and then there is what's this other one? I'm looking for common one. Looking for common.
PTSD.
No, PTSD is not so common. There
Okay.
has to be something stressful for you
What
to
about
say
all the specific anxiety disorders?
which one is generalized anxiety disorder,
Disorders,
social disorder,
social
phobic
anxiety,
anxiety.
selective mutism
Selective mutism is not
is not that
so
common.
common. I'm looking for the ones that are like so common that you're like, okay, this is what it is. Anyway,
So, do we have other questions? Okay, what is obsessive compulsive disorder?
okay,
OCD. People
OCD.
always say I have OCD. This
Yes,
one says
yeah,
I have
there's always a lot of
OCD.
confusion about that.
What it
There
really
is
means.
OCD, there's obsessive compulsive
Dis-
disorder, and there is obsessive compulsive personality disorder.
okay, so what's the difference?
the obsessive compulsive disorder is just a disorder, just like I'm having headache, I'm having this one, I'm having anxiety and all the rest of them. But obsessive compulsive personality disorder has to do with like something you do, like somebody like you say, this person have this kind of personality, this person. So it's something they is a trait they inherited. Now, what is OCD? Obsession has to do with you constant thought on something. You're always thinking about something, you obsess about that thing. That's obsession. Then compulsion has to do with repetitive pattern of behavior. Right. So it becomes an abnormality or a disorder when you can't function without being obsessive or compulsive. Let's just say somebody that likes clean environment. The person can clean this place over and over and over like 5 times
If
in a
it's
day,
not clean,
and
they
still
are
they
not.
feel something is wrong with
Something
it.
is wrong. Their
Uh,
mind can be at rest. They are
exactly.
stressed.
And if you're somebody, maybe something has happened to you, you have this irrational fear of maybe somebody's going to barge in your door. You can go and check your door handle like a couple. You see that
You
like,
will lock
okay,
the
wait,
door with five
yes,
padlocks.
no, no, no. You go back and check.
Check
You go
again.
back and check. You go back and check. You go back and check. So that's also a disorder. You need to like get it checked and get yourself treated.
So, do you have any more questions from the audience? What is the best way to treat children with anxiety disorders?
The best way to treat children with anxiety disorder, depending on the root cause of the anxiety disorder.
Is
Like,
there
let's just
any
say, for
special
instance,
consideration between management of adults and children?
there's always a special consideration because the way they think and the way you think is not the
The
same
same.
thing, right? First of all, you have to find out what cause, like this selective mutism. If a child, you have to find out what made that child to be choose not to say anything. What is that child afraid of? Like let's just say a case of a child that has been sexually abused. Most times the abusers will be like, if you say anything, I
I'm
will
going
kill
to
you.
kill you.
Exactly. Now you have to give that child constant reassurance that they are safe before you can actually get any headway in the treatment. You really have to find out what happened to that child. And you really have to be patient because they are children. The way they interpret the word and the way you interpret the word is not the
It's
same
different.
thing. So yes, there's no best way, but you have to make sure you give that child ample attention, try to understand and be patient with that child while you're offering whatever therapy you think is best for that child. And if there is need for medication, I think the doctors are in best position to know
To
which
know what
dosage and which
medication
kind of treatment
to
that the
prescribe.
child needs. Yes.
Okay, this has been a very, very fun and interactive event. We've been talking about anxiety disorders, which we've said is very common.
264 million.
264 million people. It's a lot. So it's something that is prevalent
Mm-hmm.
in our society.
Mm-hmm.
We've talked about the symptoms of anxiety disorders, the causes of anxiety disorders, the different ways it is managed. We've dealt with different questions and misconceptions around anxiety disorder. And I'm sure that if you've been following this Instagram live, you should go home with something, and you can no longer claim to be ignorant about this common condition. It's been really nice, having this conversation.
Session,
We
yes.
hope that we've been able to like impact some knowledge, even though we'll not be able to dig deep, but at least some basic knowledge of what this disorder entails, how to deal with it, and
Welcome.
how to deal with stress, how to prevent it from developing, and also to know when to seek help, when to seek professional help when you are dealing with anxiety disorder. My name is Dr. Taiwo Morakinyo, the personal physician with Limi Hospital, and this is
Alice Home Ekejuba,
it's been
clinical
really nice
assistant.
having you on this program. Do you have any
Yes.
closing words?
Yeah, just remember, stress is normal, but when it start becoming, stop
When it starts
interrupting,
compounding
yes, interrupting
and
you from your
interrupting
day
your
to day,
life, yeah.
then you know you need to seek help. Please,
Okay.
let's just stop the stigma about
Don't be
psychology.
ashamed to
Don't be
seek
ashamed.
help.
Open up. Don't
Open
keep
up. Don't
quiet.
be
Don't
ashamed
die
to
in
seek help.
silence. There's nothing to be ashamed of.
Okay.
So,
So it's been really nice having you guys on this Instagram live. We hope that you really enjoyed it. Please join us again on another edition of the Limi Hospital Instagram live. Thank you very much.
Thank you for your time. It's been my pleasure. Have a wonderful evening.
You too.
Yeah.